So today, thank you for allowing me to be here to talk about the Dallas County Food Plan Collaborative and introduce Matt Dufresne, who is a vice president with Texas Health Resources, also on the steering committee for the food plan effort, and Dr. Cullum Clark, who is a fellow at the George W. Bush Institute at SMU over economic growth, the Economic Growth Initiative, and an adjunct professor of economics, to introduce how the food plan is actually an economic strategy. So when we talk about food systems work, and you'll see this throughout our country, with a lot of cities are taking on this effort to have a comprehensive plan for their food system. There's more than 300 food policy councils throughout the US, but only really about 30 cities in the US have taken this on, as Brad kind of illustrated why. It's a massive effort to do this. But when we're talking about food systems, we're really not just talking about our food. We're talking about health, economic stability, and quality of life across our entire region. And as we've been taking this effort on in Dallas, we also want to make sure that we emphasize this is not just a social issue, it is an economic issue. And with that, what are the economic development opportunities that we have when we're taking on this kind of effort, which is really exciting. So thank you for joining me today. Cullum, I'm going to start with you.
Sure.
Because you've done a lot of work in a lot of research in human capital and, of course, economic strategy. So I'm curious, when Dallas invests so heavily in sectors like tech, real estate, and logistics, what does it look like if we treated the food system with that same economic development lens?
Oh, that's such a great question. Thank you so much for having me. This is great to be here at EarthX with all of you all. Let's see. Well, I think when we talk about investing in food systems, particularly at the public sector level, I think I'm an economist. I kind of think in terms of numbers, markets, like what it actually costs to do things. And I think, well, first of all, let me say I'm really thrilled to read all about the food plan and the work you all are doing. And if you think across the 5 buckets of activity that I think we're going to be talking about, investment means different things in different of the buckets. So when we talk about food deserts, access to healthy food within reasonable proximity of where people live, I think very simply there, we are talking about whether it's the public sector, maybe nonprofit, subsidizing novel modes of food retail stores, very simply. I mean, we shouldn't overcomplicate the matter. My grandfather and his brother started a grocery store business. I know from growing up that the profit margin in a profitable grocery store business in a relatively prosperous part of town, if you will, is razor thin. Just going from for-profit to nonprofit means that you could probably cut prices by about 2 to 3% and no more. Which would essentially mean that it's not economical to build the kind of stores my grandfather was involved in building in our lowest income and also least dense in terms of people per square mile areas. To make it work, it's going to take a bigger subsidy, and I think that what we really need to see is a lot of experimentation. What are the models that can work? Is it some sort of public-private partnership? Is it just a nonprofit entity that sets up, a pilot store and then tries to go to more stores in underserved locations? Whatever it is, it would take subsidy. Just being nonprofit isn't enough. Somebody has to actually write a check to support the operating loss associated with being in a relatively low-income, low-density area. Food waste is a whole nother bucket in you all's activity. What does it mean to invest in trying to reduce food waste? Well, I think that's kind of a big systems issue. That is about capturing the food that is otherwise going to be wasted and moving it to people who need it, which I think the private sector economy on the whole will not take care of because, I'm a big fan of markets. I like the private sector. I think the private sector does a pretty fantastic job of delivering food in abundance for, relatively well-off people, if you will. But to capture food waste, well, the private market produces a lot of food waste. It's a model that works economically. If somebody could have made a bunch of money by capturing what otherwise is going to be wasted and redirecting it, probably we'd already be seeing that. So again, this means building transportation and logistics systems. We kind of know how to do this in the private sector. We're probably less established at doing this in a way that is publicly funded. And I think there too, it would take some experimentation and it would take money for sure. So when we actually think about, say, City of Dallas or Dallas County, what are they actually spending their budgets on? Well, they spend them on a lot of, as you noted, I think in the question, Whitney, a lot of perfectly noble, important things. I can't think of anything where I think of what a total waste. Why are they spending money on that? But they're really spending virtually zero on the two examples that I just mentioned. And I think the food plan has 3 other buckets, and I don't want to go on all morning, but we could say the same thing about the other 3. Yeah. Finally, it takes money. The question is it a public sector priority? Also, is it a nonprofit, philanthropic sector priority? Heretofore, I think it hasn't fully been. So I'd like to think that we could reimagine that.
Matt, I know Texas Health Resources has done a tremendous amount of work in this area, including the economic opportunity, the impact of investing in food systems, and particularly in food as medicine. So I'm curious just what you've seen from all of the research that THR has done around the impact of this and the ROI.
Great points, and thanks for having me today. Texas Health certainly has a unique perspective in looking at it from the health outcomes lens. But I think what's unique from our point of view is not just that we're looking at improving the health of the community, but we truly are looking at investing in the community regardless of whether there are patients or not. And I think that that's something that probably we all have to embrace is improving just general health and well-being for the community for the sake of doing so. A few things that we've looked at, we've done some deep level research in a couple of ways. We've looked at what is truly the primary barriers that consumers face when it comes to accessing produce in the community. Interestingly enough, and this was conducted with Gallup in the last year and a half, interestingly enough, community members indicated that access in general was not the primary barrier. So we all in this room could go and buy a Ferrari. We know how to access it, but do we have the means to do so, right? So really drawing the distinction between access in general versus the ability to actually purchase it and consume it. There's a big distinction there. And I think when we think about solutions, we have to clearly identify the root cause issues, which may not be what we think about at face value. So there was a lot of research and awareness that we gained and that we're sharing with the community about that space in general. We've invested close to $10 million over the last 7 years in this nutrition insecurity space. And for us, we really make the distinction between nutrition security and food security. And clearly there's a different goal and different means to achieve those goals. But in this last year, we really wanted to understand the economic impact of all the food work that we're doing. And by the way, we administer the Double Up Food Bucks program, doubling SNAP benefits. We administer, we don't call them pantries, but a healthy pantry focused on produce. We work with local growers and local farmers. We provide infrastructure grants, so we do a lot across the whole space. But we really wanted to understand what is the impact of that from a financial perspective. We know it from a goodwill perspective. We know it's improving health and well-being outcomes. But we conducted a research project with UNT to understand the economic impact of all those food programs, and it was the same consistent for each individual one as well as at the macro level. For every dollar that we invested, it returned an economic impact to the DFW market by $2.12. So significant in terms of the amount of economic return to the community. It is noteworthy that most of that stayed local, so an additional 9 cents went to the state level. But I think it really speaks to the impact economically when we, as a community, invest in the local food infrastructure.
Good, thank you. Colin, your research talks about EDS and MEDS. Mm-hmm. Correct, okay. So I make sure I read that correctly. Yeah. So actually, Owen brought this up too, the role of anchor institutions. Mm-hmm. And how could that be a part of the economic strategy as we look at the food plan effort? And, we're building this out right now. So what are your thoughts on that?
Ooh, that's a great question. Well, we just heard about a very large med system, in the hospital world and medical center world. So I've written about the role of eds and meds, meaning higher ed and academic medical center type institutions, or in general big hospital systems, in as drivers of economic development in local economies. So I think that's what you're referring to. So in food systems, well, I think one important point of well, let me put it this way. Okay, in the report, we break down the ways that eds and meds institutions contribute to local economies into three buckets: talent, innovation, and place. Okay, we didn't make that up. That's kind of common out there in the discussion of the role, economic development role of universities and hospitals. So if you think of each of those, the innovation side, I think the question is simply what do these institutions do research on? Because the research has great, ultimate effects on the wider economy, particularly including locally. So one immediate question is, might universities invest more? I think they probably invest very, very little right now on average, but invest more in research on food systems, on local food ecosystems. It's a good topic. I hope that that we just see more more research would likely translate to to more ideas that kind of spread nationally and globally. On the talent side, I think the question is about training young people. Really, well, they're not always young. We're lifelong learners, right? But very simply, it is about do you offer, classes and ultimately programs that prepare people to work in this very big piece of the economy in some innovative, thoughtful way. And that's not something that's well developed in the same way. I mean, I think of SMU, where I'm an adjunct part-time professor. There's not just, of course, a very good business school, the Cox School of Business, but there are specific paths that train you very well to work in the oil and gas section of the economy, and to work in the real estate development sector of the economy, and to work in the tech sector of the economy. But, the food sector of the economy is a pretty big sector, and we don't really have any pathways for that, so it'd be nice to see that. And on place, I think the big question here, which is sort of the most, you could say, out there, or if you will, innovative part of the work that I've done on all this. It is that eds and meds institutions have a big physical footprint in their cities usually, and the question is, how do they use it? Is it finally a kind of a walled fortress, a gigantic set of several buildings that feel pretty off-putting to the rest of the community, other than if you are a student there, or if you are a doctor there, or a nurse, or whatever. If you're a patient, you're probably afraid, but you still go because you got to do so. But to what degree do these institutions create a kind of porosity, a sort of not a big dark line, but kind of a dotted line around the campus that in some sense invites people from the community in? And if you do that, you probably start to think in whole different ways. Maybe you start by thinking in terms of do we have food insecurity even among our students or our staff? Which, depending on the university, some will have quite a bit of it when they look into it. SMU, not so much. A number of other institutions here in our city and county, absolutely. They absolutely do. But if you start to think about that, then maybe you go on and think about, well, if we're trying to address food insecurity for our students and staff, maybe we ought to think about the people who live nearby, who aren't our students and staff. And that's a reasonable thing, I think, for these institutions to think about, too.
Thank you. Yeah, great answer. So I know we have 3 minutes left, little less than 4 minutes. So I was curious. Policy came up in the other panel. There's some policy that's being discussed right now. So Matt, I'm going to start with you. If you could change one policy or incentive right now to unlock the growth in the food economy, what would that be?
Yeah, so I'll answer two ways. First of all, I think we have to change our view about how we see the food economy. We talk about economic development, we talk about health and well-being, we talk about these different things in isolation of the others, right? I think at the end of the day, we have to see the interconnectedness of those things and really to change the system at the macro level. So I think number one, we have to change our worldview. From a health perspective, and clearly, we've already said it, economics drives this in a lot of ways. We've been heavy advocates at the federal level, for CMS, which oversees Medicare and Medicaid, to include produce and food as an accountable option for reimbursement within healthcare. That to this day, that's been one of the barriers. Just yesterday, a bill was introduced in the House that we've been heavily involved in that would create an accountable bundle, basically, where we can treat patients and include food as part of that prescription. That I think, when it comes to like the macro level policy, if the feds are putting money in it, that will drive other investments as well, including private insurance. So that's something, again, we were looking at the macro and the micro level, but it's certainly from the broader national level, that's something that we think can be significant in terms of the overall impact. Clearly, this is a multi-year time frame, but we're optimistic that that will drive other decisions and drive other local funding, specifically, again, to think about food as medicine, and a lot of that being focused on hyper-local foods as well.
Yeah, I think I'll come back to maybe I'll close where I started. I think that if I was, if could wave the magic wand, as it were, the proverbial wand, and do one single thing here in Dallas County, I think I would lead with create a program to subsidize the establishment of some nonprofit food stores in severely underserved food desert type locations. I would, if I was advising city government, I would say pick your locations carefully so that they really are severely underserved food deserts. One thing you don't want to do, I mean, I for one would not imitate what the mayor of New York has promised to do, which is government-run stores in multiple places across the city, because that would have the effect of it's not going to undermine. I don't know if y'all know New York City well. It's not going to undermine Dean and DeLuca, like the fancy places where I was sometimes privileged to shop when I lived there. It's going to undermine the pretty cheap mom and pop bodega, the little tiny store that is actually operated by people of probably below average income that actually do serve that city pretty well. So I would try to understand the actual landscape in a Dallas well, and then genuinely focus on the food deserts, which we undoubtedly have. I would love to imagine a future in which the federal government or maybe the state government creates money to fund such subsidies, because it's not going to work without subsidy. The local government will never have enough money to do this right if it doesn't actually cut some other stuff, and that's not so easy to do. Let's dare to dream. Maybe we can imagine a future where the federal government does start to actually create a pool of capital that passes through local governments and ultimately supports maybe a flowering of nonprofit healthy food stores.
Thank you. Can I ask one more question? I'm just going to do it. Sorry, super quick. One concrete step Dallas can take in the next 12 months is we're creating this plan that would be a core part of driving this economic opportunity in the future. What's one thing that we should add in the plan?
It sounds simple. That was the comment that was made. I think what really drives it is you have to have corporate, elected, and individual community champions. That's essential in order to drive the outcome, and that's the one thing that can be done, and people that are willing to use their social and political capital to advance that.
How about on the food waste issue, a one single initiative, if you will, maybe contract with one nonprofit, maybe it's the North Texas Food Bank, that'd probably be the natural partner, but have local government, county government, contract with them to essentially just capture a lot more food waste from big institutions like hospitals and universities and the school systems and so forth, and bring it into the North Central Food Bank system. Because once in the system, they're very, very good at distributing the food that's in the system out to a lot of points around the city and the county. So, so just a chunk of money to go try to capture a lot of food that can otherwise go to a landfill. That's where I would start.
Thank you so much, Matt and Colum. This was a just really excellent conversation. And for you all to learn more about the Dallas Food Plan, we have a website, dallasfoodplan.org. You can also click the QR code. There's more than 450 organizations involved now, including our governing steering committee. So as we're working towards building the plan and finalizing this in October, the more the merrier. If you'd like to be involved or like to learn more, visit our website. You can sign up for our newsletter. We have a podcast. So please stay informed and stay engaged in this effort, because the more voices, the more data, the more that we're informing this comprehensive strategy, the stronger it will be. So thank you, EarthX. Thank you for allowing us to be here today.